Today, we have a great presentation, the Downtime Trace and SkillNet, the future of HTM workforce readiness. Downtime Trace and SkillNet are partnering to improve speed, lower pricing, and provide standardization of communication to healthcare customers and medical equipment service providers. Together, they solve one of the industry's biggest challenges, matching the right talent to the right need at the right time. Downtime Trace delivers an on-demand marketplace that connects hospitals with skilled technicians in moments of urgent downtime. Health systems can immediately locate skilled professionals to keep equipment online and patient care from being interrupted. SkillNet provides the Downtime Trace marketplace with accurate, validated, and standardized transcripts that capture a service technician's training, certification, and on-the-job experience in one portable record. By creating a common language of skills, SkillNet ensures hospitals know exactly what each technician is capable of. The combined values include speed, efficiency, opportunity. Downtime Trace and SkillNet have joined forces to empower a very talented workforce, and we are going to highlight that today. Now it's trivia time. That's right, we're going to give away a multi-tool. So use the questions feature on the app and answer the following trivia question. Halloween is just around the corner, so which state produces the most pumpkins? Which state in the United States produces the most pumpkins? Go ahead and answer using the question feature, and we'll pick a winner and announce the winner later in the webinar. I want to remind everyone that today's presentation is eligible for 1 CE credit from the ACI. 1 hour after the end of today's broadcast, you will receive an emailed survey. Completing that survey will grant access to a certificate that you can download and print from your computer. We will wrap up today's broadcast, with a Q&A session. Please note that the webinar dashboard includes a question feature, and you can submit your questions for our presenters at any time during the demo. Today's presenters are Mike Kritzman, the founder and CEO of SkillNet, Jason Mobley, and he is the Chief Products Officer and co-founder of Downtime Trace, and Dave Francoeur. He is an advisor to Downtime Trace and has decades of experience in the HTM industry. Dave, you may begin whenever you are ready.
As always, thank you, Mr. Wallace. Phenomenal job. And I want to take a second to thank Mr. Krieg and the MD Publishing Group, as always, for providing this venue and the opportunity for us to do this. I want to take a second to thank all of you that joined. Some of you may know about this. We're hoping to share some new information. We're really hoping to show that the value of our two organizations coming together and what that looks like for all of you, and for you taking in time to invest in your own futures and endeavors and around being on this thing. So thank you again for that. With that, I want to talk a little bit about what we hope to achieve today. And with that, I have a little thing I want to read. So if you'll bear with me for a second. As we look ahead, it's clear that our industry is changing and changing fast. Technology is becoming not just a part of what we do, but the backbone of how we do it. The organizations and professionals who thrive in the next chapter of HTM will be the ones who embrace the change early and use technology as a tool to take ownership of their own success. Whether you work for a manufacturer, an independent service organization, or an in-house team, one truth remains the same. You are responsible for your own destination. Applications and digital tools will soon be essential to our daily workflow as our toolkits once were. There's how we stay connected to customers, remain viable in the field, and demonstrate our value, not just through words, but through data, performance, continuous professional growth. Imagine having a platform that helps you track your skills, plan your professional development, and showcase your achievements. Something you can use in your annual review and an interview, or when you're negotiating your next opportunity. For those who are independent or considering a gig-based path, this kind of digital record becomes your portfolio, your way to show prospective clients a full scope of your talent and experience. So my message today is simple. Don't wait for change to come to you, be part of it. Jump on the bandwagon early, take control of your professional destiny, adopt the tools and empower you to lead your career rather than follow it. Let us know how we can help you. This is what this is about. This, as far as I'm concerned, we're going to share. You may know about Downtime Trace, but Jason's going to share why we did it, what we did, how we did it, and the changes that are coming and how that should impact the industry. Mike's going to share the product that he's got in terms of how that can impact the industry and how you should benefit from that. So without further ado, we'll just continue on and we'll move from there. What I would ask is let's just start with our first poll, Mike, if you don't mind. Maybe change the slide.
Sorry, so we have the first poll up, and the question is, do you currently have any official digital proof of your technical abilities that you personally control? And the options to answer are, yes, I already have one, kind of, but it's internal only, or no, nothing exists today. All right, looks like we have some results coming in. 60% said no, nothing exists today. And then 20% each for each of the other two answers, which were, yes, I already have one. Another answer, kind of, but it's internal only. So 60% have nothing.
Yeah, that's great. And that's great feedback. And candidly, it's kind of what I was thinking. Mike, Jason, any thoughts related to the results of that test?
I'll go forward. Can you hear me?
Yes.
Yeah, I'm not surprised. The the depth and breadth of the knowledge required to operate as an HTM professional is daunting. And trying to keep it all tracked on a spreadsheet or Word document or something. I've talked to people that have been, BMETs for 20 years that are using 3-ring binders for their equipment certifications. And happy to usher in an age of using mobile phones to make it easy to keep track of all that information. But it's not surprising that many have not ventured to try to do it themselves. It's hard.
Mm-hmm. Jason, any thoughts?
I agree. I was expecting those results as well. We, as you know, Dave, we at Downtime Trace, we went through a time where we were looking for a solution for that exact question, and unable to find one for a while until we came upon SkillNet.
Yep. Awesome. All right, let's go to the next slide if you don't mind, Mike. So, look, at the end of the day, what's I believe is painfully obvious. Look for feedback. Maybe you guys can ask me questions if you have, excuse me, if you have thoughts or concerns. But, look, our manual processes are outdated. They're antiquated. Our communication is something that is absolutely lacking in this industry. As a matter of fact, I'm going to be doing a presentation at the upcoming MD Expo on communication. But communication, for the 40 plus years that I've been in this industry, it has been and still remains the #1 problem that our customers tell us is the biggest with the challenges that they have, regardless whether you're in-house, ISO, OEM, it doesn't matter. Communication is a major thing. And on top of that, the fragmented skill data, right? I mean, just the fragmented data period, whether it's skills or just the analytic data that we have or the work orders and whatnot. So all of these things are things that can be improved, and we believe that we're going to be bringing tools and skill sets through this process. And that's what this presentation is going to be about. So just stay tight and work with that, and we'll go from there. Mike, Jason, any thoughts related to this?
Well, I just say the skill data is the nature of our business, and there's a term that I've coined, and I don't want it to be derogatory to anyone, but we call it tribal knowledge, meaning that there's not a good database to find out who's the right tech to send for a certain kind of repair or maintenance. It's in someone's head. And that's a dangerous place for this kind of knowledge, because if that leader retired, took another job, all that knowledge goes out the door with them. So having it in a searchable database is way better than in somebody's head.
Jason?
Yeah, no, I agree. I think I think a lot of us who have been in this industry for a long time, we've seen this as a, you know, as an area that if we can improve on it, we can do better. We can provide better quality to our services. We can provide better pricing. Not knowing what resources are at your disposal as a company is one issue, and it's not easy, like Mike was saying, to always track that and always know exactly how much talent you have and where that talent currently is. So tracking it ongoing. But what we haven't seen is the ability, is a tool to allow the individual to take accountability for their own building of that profile or building of that portfolio of their talent. And I think that's something that will help to modernize or to push our community forward, when we can take personal accountability for our own skill set and tracking of training and those items. So yeah, I think this is definitely overdue.
Yeah, I'd add one more color to, by virtue of an example, is there are health systems that we work with that have invested to send technicians to OEM training. That tech gets certified, comes back, shares the, you know, the PDF or you know, a picture of the certification they earned. It gets uploaded into the HR system under their, you know, under their profile in HR, and then the equipment they got trained on gets broken, and they forgot that they sent this person a training, and end up calling the OEM at significant expense and often a delay, just because they stored it somewhere that wasn't searchable. So I do think there's lots of examples of how things can be better, and I'm proud to be part of that improvement cycle that we're working on.
Okay, thanks. Let's go to the next slide. Thanks, Mike. So look, at the end of the day, I said it earlier, I'm going to say it again. I don't envision it's going to be a problem that we're going to solve overnight. Communication is absolutely an issue, and I'm going to keep reiterating, whether you're OEM, ISO, in-house, gig worker, it's always the same thing. And it's as simple as, in a lot of cases, letting the customer know, I'm on my way, I've arrived, I've solved the problem. Here's the invoice. Is it accurate? Does it reflect what I did? I actually fixed the problem. Here's what I found. Here's what we can do to prevent it from the future. Those are all really basic, simple things that we just don't do very well as an industry. And I think some of these things that we're going to show you are going to help solve that and make them automated, which makes it that much easier. In addition to, we all know, whether it's in-house and we're just tracking the paperwork and there is no cost, whether it's somebody from the outside doing it, the accuracy around the invoicing and the management of the financials is almost can't be done. It's crazy. And when that gets up to our finance departments and we're trying to figure out how to manage that, it makes it a real challenge. And I think we have tools that are going to help streamline that and make it better. So, you know, look, at the end of the day, there's always nuances and there's always things that are preventing us from being more successful. But what's most important, the whole reason why I believe we're all into this industry and why we exist, is around enhancing the patient satisfaction and experience. And these are things that we think we're going to bring to the table, which improve those things. So with that, Jason, thoughts?
Yeah, no, I think you're spot on. I mean, understanding the challenges and the impacts that those current challenges have on our industry is the only starting point we have. We have to understand where those challenges are, what impacts they're having on not only us, but more importantly, our customers. And I know that's what we tried to keep in mind, keep in the forefront while we're contributing and developing the technology that we've developed.
Mike?
Yeah, just echo what you guys said. Good points.
Sounds great. Well, why don't we go to our next question, if you don't mind. Mike, flip the chart and let's go to our next question. John, you got that?
Yep, I'm right here. The next poll question is up. We're asking if hospitals allowed approved side work or surge support work, would you want that option? And the options to answer are yes, immediately, maybe, depends on the hours pay, or not interested. So we'll have some questions coming in. And 63% said maybe, depends on hours pay. 25% said they were not interested, and 13% said yes, immediately. So 76% are interested.
Yeah, that's what I got from that too. Thanks, John. Well, that's great. And, you know, I believe you're going to find out that we're providing a tool that does that. Now, whether or not your organization allows it, that's a separate thing. But I think you're going to find that you're going to see through this presentation that you're going to be afforded a vehicle by which that could happen, should you choose, should it be available. Jason, thoughts related to that?
No, I think that's spot on. I mean, what I'm about to talk to here in a second, kind of touch on this topic as well.
Yeah, great. Mike?
Yep, let's just keep going.
All right. With that, without further ado, Jason's going to give us a little high level, as I said, the whys, the whats, the what fors, and the changes that have been going on around Downtime Trace. So Jason, please.
Yeah, great. Thanks, Dave. Appreciate it. So I want to give you a quick overview, high level overview of what Downtime Trace is, kind of how it came about, the aha moment, and relate that to that last poll question. Downtime Trace is a mobile app and a web app that does a lot, but at its core, it does one major thing, and that's connecting equipment owners, medical device or medical equipment owners, healthcare facilities to viable service options for their assets, pre-qualified options in a one, like what we call a blast. You see the graphic here, a rocket ship taking off. That's because when a request goes out, it's going out to all of the viable options within our system all at once, and it's driving speed of response. And so what that does is it provides a one place to go for a healthcare customer to, no matter what type of asset it is. You can see on this graphic, we did start with one modality or one specialty in imaging. However, we're already moving on since our launch to other types of assets as well. So started with imaging. The system is capable of facilitating really any specialty or any type of medical equipment. We have built something to allow an instantaneous connection to options that otherwise would be hard to find sometimes, options that a healthcare customer might not know is out there. And then with that connection, we're able to drive communications through the technology as well for the service event. So the customer gets to choose the vendor, gets to choose the pricing. The pricing set by the vendor, by the service providers, by you, and the customer gets to select based on the price, the availability of that service option for each service event. So that's how we drive speed, is by presenting options for each service event with a really quick process. When we set out to build Downtime Trace, there was another really important aspect that we wanted to make sure we captured, and that was a consumer feel to the app, making it something that was familiar to everyone that used it, familiar in their personal lives and the apps that they're used to interacting with on the daily basis in their personal lives. If we could bring that to our market, to our industry, to the things that we do, we're going to have a much better experience and a much, I guess, a simplified way to do something that is otherwise really complicated. That's the communications, the tracking of repair events in real time, that's handling the billing, all the stuff that Downtime Trace does really well. We needed to simplify that from the way, at least in the way that's presented to the users. And I think we've achieved that. It's been getting a lot of great reviews since we've launched, and we've launched in the states of Texas and Florida. However, we're already progressing to new states now, and we're ready to move fast throughout the U.S. So if there is other needs out there, we're capable of acting fast and growing fast. And Mike, if you want to go to the next slide, I can talk about kind of how it works, how Downtime Trace works.
You bet.
Awesome. So again, it's really simple in concept. The way that it works is the customer submits a request for a bid. That competitive, or that request goes out. The competitive bids come back. Once the customer selects which service provider they want, the service provider then interacts with the app to provide a real-time updates of what's going on with the diagnosis of the problem, the resolution of the problem. So you're servicing or repair or maintenance, everything is visible in real time to every party. So the service provider might be filling out the app or interacting with the app, but the healthcare customer will always see what's going on and be notified. Different people within their organization can be notified at different points in the repair process or in the service event. At its core, in order for that to happen, there's a couple things that we needed to make sure were the foundation of what we built, and that's this matching. In order to match quickly, we needed to set up on the customer side a way for them to preload their assets and tell us what type of assets they are, and our system be able to identify down to the make and model and any special software versions of those assets. If it's preloaded, then at the time that it breaks, or the time that it needs maintenance, it's one tap. It's a simple tap. It's tell us which asset is broken and tell us what's wrong with it and blast it out. On the other side, we needed to set up, for this matching to work, we needed to set up our service providers to identify what specific expertise and skills they had, because we didn't want our technology to be something like a marketplace, like a magazine, if you will, or a phone book. We wanted it to actually be exacting in the way that it provided these options back to the healthcare customer. So the bids that come back are only going to be from service providers who are capable, available, and geographically located next to those assets. And so it's a filtered list, if you will, rather than a marketplace of going out and choosing a service provider. You're actually getting only interested bids as a customer. In order to do that, we needed to find a system, find a way to vet and to pre-qualify experience and expertise and skill sets of service providers coming on board. We went out and looked for a technology that we could patch in, or that we could tap into some way this has been done in the past in our industry, and it was not easy. It wasn't easy to find a solution out there. And when we came across SkillNet, heard Mike presenting in a different, really similar webinar, it was this aha moment. Dave, you were there when we heard Mike for the first time. It was like, this is what we've been looking for. We need a technology that's capable of tracking these things as well, because as technicians interact with our app and perform repairs, they're gaining experience in real time right there. So that's what we found with SkillNet. And I think, and Mike, are you ready to talk about SkillNet now?
I think we have a poll question first, but
Okay.
I'm ready.
Okay, let's go to
Always
poll question.
ready. Thank you.
All right.
John, we got a poll question for you.
Yep, the poll question just popped up. The biggest blocker for getting recognized or paid more for your abilities. And the options to select are: nobody sees the work I actually do, no official way to prove experience, promotions take too long, politics, or I haven't looked for opportunities. So there's 4 options there. People will vote on which one is best for them. I have some results coming in, and you won't believe it, but it is an even split all across the board. It was 25% for each answer.
Very
That's unusual.
That's really cool. All right.
Yeah.
Well, would anybody care to comment on those results or thoughts? Yeah, I think that's just interesting. Let's just move on. Why don't you tell us a little bit about SkillNet and why I think and everybody else thinks that this should be the standard in the industry and people should take control of their own destiny and be accountable for all the stuff they're doing and have it as a tool to make sure that they get recognized and put a professional development plan together. So, sorry, go ahead.
Yeah, thank you, Dave. And I'm glad you guys found me.
Me too.
That was fortuitous. So there's always different ways you can look at something, and I just broke this down into two simple views. One is for those of you who are technicians, SkillNet provides a mobile app that makes it easy for you to keep track of all the things you're capable of doing. And I'm going to talk about that in some more detail in another slide. So for technicians, we went back and forth about, do we charge something? How do we do this properly? What's the right way to do it? And we come to the conclusion that technicians don't get paid enough as it is. So it's a free download. Just go to the Apple Store and go look up SkillNet Mobile, and you can start using it. No strings attached. Now, if you work for a health system or an ISO, our hope is that they would be interested in the aggregation of the data from their technicians. And I'm proud to share that we have succeeded and landed some very prestigious clients. But for this skill management for them, we bring together all of the individual data. And so if you downloaded the app and you put your data in there, nobody else can see it until such time that if you worked for a health system and they made a purchase with us so that they could pull these reports together, all you would have to do is enter a code that connects you to their system. And if you left their system and went to a different one, you would just undo that code. And if you go to a different one, you'd put in their code if they had one. This is your transcript, it's your career. I really like how Dave, phrases it that, take charge of your own career. This is not a resume. It's a record of various things that you're capable of and things that you're working on. So that's the skill management product. We've got two other products. They're not really part of today's conversation. We're really going into the deep end of the pool around skill data. But we have a mentor application that we've constructed. Probably won't surprise you that we're tracking skill development through the mentor's help. So if you were working on getting better at CT machines and you got a mentor to help show you the ropes on that, you would show that mentor helped you to improve your abilities with CTs. We also have another product that creates dashboards from CMMS data. And so far we've integrated to Nivolo, but we've got others in our sites. CMMS are great tools for generating work orders, but the reporting on those systems left some room to be desired. So we've built out 25 different dashboards that show things like utilization. We're really aiming at identifying where work is being outsourced and if there's staff available that could learn that work quickly because they know something adjacent, and help in the system to lower costs by insourcing instead of outsourcing. So that product's called SkillNet Insights, and very exciting feedback from the market on that. Seems like everybody's interested in saving money, no surprise, right? So that's a high level SkillNet from 2 points of view. I hope that was helpful. We've dialed in HTM. I've been working with the College of Biomedical Equipment Technology, Manny Gonzalez, some of you might know. And he knocked on our door 5 years ago, and we've had a chance to really dial in a competency structure for BMETs, imaging techs, and facilities people as individual contributors and as managers and leaders. We recently added a deep dive on cyber. One of our clients wanted to do cyber. So, and when I say that we've dialed these in, we've got the proficiency models for these different roles that a customer could accept or adjust, because we really want this to match as perfectly as we can to the health system. So if they don't have any Philips machines, there's no point in asking the imaging techs, you know, what do they know about Philips if there's no machines on premise. So when I say built for HTM, the mobile app is easy and quick. If you got a cert, I'd be surprised if it took you a minute to enter that data, take a picture of the cert, and then you've got a digital record of it. Like I said, it's been dialed in for HTM. Here's what the mobile app looks like, and I hope it seems intuitive. I'm just going to quickly cover the various functions. On the top left, you can see the word certs, and this is the part of the application where you would enter whether you have a professional certification like a CBET from Amy, or an equipment certification, something from Philips or GE or Toshiba or others. And you take a picture of it, and then that, if the health system subscribes, becomes part of a searchable database of who has which certs, to avoid the problem I talked about a few minutes ago, where they sent somebody to training, the person earned the cert, but then it got lost, and they ended up calling the OEM. So if you're using a 3-ring binder, put that bad boy away, take pictures, keep it in your pocket. The next section is admin. The admin section is how you manage your account, like I was talking about, connecting to a health system. There's also a transcript feature in admin that lets you actually print or share these records with a prospective employer, if that was of interest, or with your own employer, so you can get recognition for all the things you've worked so hard to learn. One of the other sort of homeless areas, I call it homeless, it's just there was no really good place for it, is continuing ed, and keeping track of continuing ed. Like, I think everybody's getting an hour today. Where do you keep track of that? So you just open the CEU part of SkillNet, put down, you got an hour from attending this webinar, and some certifications require CEUs as continuous improvement. Even if nobody's requiring it, it's good to keep track of. The Tell a Friend is just a way to tell others about our app, and we appreciate if you would. Training content up on the top right over here is a place where you can connect to YouTube or other videos, including videos you'd make yourself. So right on your phone, if somebody's showing you how to do something, I'll go back to that CT machine example. If they showed you how to do something on the CT machine, you can video them doing it, and it'll go right into your training library. So later on, when you want to go access, how did I do this part of that procedure, you can get it right here instead of trying to go through your whole photos and videos that might include, things in your family or vacation trips or things like that. This is just dedicated for training content. And YouTube doesn't need a plug from me, but there is so much good quality content out on YouTube. It's incredible, and we've created a very easy way to just sync a YouTube video right to your phone. Goals are really important. I think your company or your manager might inspire you to write down your goals. This is an easy way to have them in your pocket and keep track of it. Many times a goal has different segments to it, so you've got to, do these 3 or 4 parts to get to the end, and so you can just knock those down and keep track of it. If your health system is a subscriber, they'd be able to see your progress as well as everybody else's. Skills is sort of the core of what we're doing with Downtime Trace, and this is a digital record rating your skills against an inventory like I was talking about. We've dialed these in for biomeds and imaging techs. It's a record where you'd rate yourself 1 through 5. Excuse me. Rate yourself 1 through 5, where 5 is you know it so well you could teach somebody else, and 1 is you just haven't learned it yet, and 3 is you're proficient at it, but you might need support. OJT is another, sort of area where there's not a good system to keep track of it, so we built one, keeping track of on-the-job training. What did you learn? How much time did you spend on it? And of course, that's going to feed into what you'd rate yourself in the proficiency score. So that was kind of a mouthful, and appreciate your guys' patience as I work through it. Again, the mobile app is available for you. It's SkillNet Mobile. And Dave or Jason, any comments about
Yeah,
that? I'm going to keep going.
Mike, I'd like to make some comments if I could. So look, guys, I mean, I have to tell you, as a technician, I'd have given anything to have something like this, because when it comes to annual reviews, look, I've also been a manager and had a lot of people report through to me. And as I sit trying to do annual evaluations, it's a challenge to be fair and honest and be able to keep track of what everybody's doing. If this became the standard in the industry, everybody would be working from the same platform. And the things that I love about it is that thing that Mike talked about around transcripts. I think that's huge, whether it's just from a professional development, being able to demonstrate your baseline. I think the on-job training thing, there's so many times that we do on-the-job stuff, but we just don't get credit or we're not tracking it. And this is just a great tool to do that. And you can see why when Jason and I saw this the first time, we're like, this just so lines up with what we're trying to do with Downtime Trace and being able to demonstrate the skill sets of the people that are going to go in. I just think that this is so valuable and so cool, and I'm really glad that we're part of it and being part of being able to present it. So I'll leave it at that. Jason, thoughts?
No, I agree. And like I said earlier, instantly, it's just the synergy, I think is a good word, between what Mike built and what we identified early on when we were using focus groups. Like, we didn't create Downtime Trace based on just our knowledge or our experience. We went out and we talked to industry leaders for months, and we talked a lot of thought for years before we even started on Downtime Trace. But this was always one of the topics that we knew, like introducing a new labor market. For example, if there's a 1099 or what we call a gig worker, it's a freelance worker in our industry, we need to be very sound in our approach, in the way that we introduce a new type of labor to our market and to our industry, and we need to be safe. And finding the SkillNet, I think, allowed us to go a safe path to vet these vendors, for sure.
It's a privilege to be working with you guys on that.
And we'll move on. So thanks, Jason. Let's do our last poll question, John.
You bet. So the poll question is coming up right now. And we are asking, if proving your skills was as easy as tapping a checklist on your phone as you do the work, would you actually use it? And the options are 100% yes, probably yes, maybe, time is tight, or no. But take a moment and answer the question for us, and we'll look at some results coming in. And 30% said 100% yes, followed by 70% said probably yes. So 100% said they would use it.
That's
awesome.
Great feedback. That's awesome.
Yeah, appreciate it.
All right, Mike,
let's hit the gas. What's in it for you? I think I've already talked to most of this, but if you could have all these records right at your fingertips and update them as you go, that's what we're able to do together. If your health system is a subscriber, then they can go access this on demand. But like Dave said, with our transcript, even if they don't, you can share that with them, and hopefully it'd be good for your career that they can see what you're doing. And it should save you time and make your life easier. One of the interesting things about it is when you look at an inventory of all the things that you could be good at, you'll see things that maybe you're not that good at yet, and then those things where you rated yourself lower are areas if you encounter that kind of equipment where you work, then it'd be something to request getting training for. And that's one of the big benefits for health systems is they can use the site to generate these training plans that are dialed into each person based on their proficiency records. We hope that this is something that will help you advance your career. You know, showcasing your skills, identifying what you're good at. You know, it's one of the challenges I think most people struggle with in their work is, you know, my boss doesn't know what I'm, you know, doesn't know me that well, or people don't know how good I am at various things, and this would certainly lock that down.
It's a tool that helps you drive and plan your own development. And that's what I think, you know, what I would say is if we've all been, if you look at the pyramid, that's the way all leadership has been. There's a couple people at the top and all the people at the bottom, and they do all the work. And what I'm saying is let's flip that over. Let's flip it over and make it so that you, us, the technicians, all the people at the top now, and we're feeding the information down to help them know where we're at so that they can help build a program around our skill sets to make the organization successful. So I'm saying own your own destiny. I'm telling you, this is the opportunity. This is a direction of change. Sorry, Mike, go ahead.
No, thank you. Nothing to be sorry about. And as I mentioned, it's a privilege to support Downtime Trace as they try to revolutionize the industry with being able to engage a gig workforce to provide services so that they get it right and send the right people. So that's a big thing. So the combined solution, and Jason, I think I'm going to ask you to talk to this one first, if you don't mind.
Yeah, sure. Yeah, real quick. I think we've kind of touched on this already as we've gone throughout the presentation, but when we talk about combining the two technologies to provide a more robust or a better overall system of introducing, it's not only about introducing a new labor type like 1099s, but it's also very beneficial at a company standpoint, like you were describing, Mike. So I don't want to limit it to only 1099s being our gig workers being the reason for SkillNet, but because it's very valuable at the company level as well. The way that these things can join forces to create a powerful ecosystem together, it provides confidence to the users of the system that the competence levels have been vetted appropriately, not just us saying that yeah, this person's qualified. We actually use a system that's a proven system, and that leads to more reliable matching of that broken asset or the asset in need of maintenance and in real time, like I was describing earlier. It also provides an extra way for a customer to see what their documentation, so a way for a customer to actually view the documentation, so it's not just us saying it once again. And then it provides additional, I guess, future looking intelligence about an individual. It's not enough to have an individual there. To identify those skill sets and the ongoing improvements of those skill sets is absolutely needed for something like on-demand work, like we would design on-demand opportunities. It's absolutely necessary that this technology, like I was saying before, is robust, it's sound, it's competent, all these things. It's just yeah, this combination just it it's something that is going to together make Downtime Trace that much more recognizable or much more stable.
Mike, you want to get to the last slide so then we take some questions?
Yep, for sure. So I think we said all this. So just kind of a summary. By working together, we're introducing a new, almost Uber-like way to get equipment service. You need CT machine work. Maybe in the past you've called the OEM, and we're trying to make it possible that you can have high confidence that you can call Downtime Trace, and Downtime Trace will bring a properly vetted and capable person. And from a technician's point of view, you know, if working on side gigs would be allowed, then it's a new income source for you, and a chance. You know, even if you're retired or getting ready to retire, this is a way that you can continue to earn and you know, and do the kind of work that you like. So
So in the interest of time, you got another slide, Mike?
yeah, this there's this slide and one summary slide, and we're done.
Okay, sorry, go ahead.
No, I think this was yours, Dave.
Okay, sorry. So look, at the end of the day, all I can say is that I've said it times, I said it again, I would like people to start thinking in terms of, I want to, even though I work for another employer, which is great, you should do whatever you want, but I think you should start taking control, mastery of your own destination, and use these tools to be more proficient and have that transcript, have the ability to get the communication tools that come with Downtime Trace, get the accountability from the invoicing and all that. Just use the tools. I think we're starting to change the industry. We're flipping that triangle up, and I would just ask you to be part of that. So, like I said, Mike, I just want to make sure we have enough time for questions. So, what's our last slide? Or, yeah, I mean, we've talked about all this. You guys want to sum it up in a minute before we get to the questions?
Yeah, I think, you know, I would just echo that if you start doing this, you'll save time and effort, and hopefully be able to showcase what you're good at. If you are at a health system and you're in a leadership role, moving from spreadsheets or what we referred to as tribal knowledge, where it's in people's heads but it's not really written down. Certainly big benefit there. Joint Commission has some requirements for tracking proficiency data, and if the health system wanted to get ISO certified, the ISO certification requires similar digital assets around training records to make sure that the quality levels are what they should be. You know, and ISOs are third-party service firms. It's a terrific way to keep track of that data, like what we've talked about. So there you go.
Jason, any last second thoughts?
No, I think we summed it up great.
Cool. John, questions? We have questions. We got about 12 minutes. We got about 10, 11 minutes. Got any questions?
Yes, so I want to make sure everybody knows that we are still open. You can still submit some questions if you have any. We did have some that came in. So if I'm a biomed tech who wants to earn extra income outside my hospital, how does SkillNet verify my abilities?
Good question.
Well, SkillNet doesn't technically verify your abilities by itself. In our partnership with Downtime Trace, there is like an auditor that would go through the data that you've submitted to validate. If you work at a health system and the health system's a subscriber, your manager would have access to the data to validate. Somebody who is expert in the field needs to do that validation. It's not done through AI or you know, or a technology thing presently. So
Yeah, that's exactly what I was going to say. Great question, first of all. But yes, Downtime Trace uses the data that SkillNet organizes and makes it easy for the users to add that data. Downtime Trace uses the SkillNet system by a third-party independent expert assessor to go through and validate the data that's there.
That was a great question and good answers, guys. Thanks. John?
Another question we had was, with time constraints, how difficult is it to track proof of hands-on work as the tech's doing the job? Is it literally just part of the normal workflow, or how does that work?
if you remember when I had the screen up about OJT, this one, it's just a little form where it surprised me if it took you more than a minute. We tried to make this stuff, just like not take more than a minute to do any of it. The only exception would be if you were doing a video of somebody training you on something, you can go as long as you want. But these little data entry forms, just quick and easy. And with the OJT, you can also have it validated by sending a link to the person that trained you so that they can validate that indeed they did. So not that anybody would ever make that up, but sometimes having things validated is helpful.
Like, I think what's important here, and this is where I'm as an outsider, look, although you may not have been officially formally trained, the fact of the matter is you may have done 1,000 PMs on an infusion pump as an example. I would think that you're pretty proficient at that point. So that's the on-the-job training that I think would become very important in terms of your skill set and your transcript and that type of stuff. So yes, I agree, and I think that's what that is. Excuse me, John, another question?
This helped me stand out for higher paying side jobs, traveler roles, or cross-facility support? Or is it mainly just for internal performance reviews?
Jason, you want to take that one?
Yeah, I'll let Mike start on that one. I think that's pretty SkillNet directed, it sounded like.
Yeah, I think go both ways actually. So if you're working at a health system and not doing work through Downtime Trace, you'd be potentially using it for performance reviews or as evidence of why you could be promoted, why you could handle more responsibilities, maybe even move into a leadership role. On the other side, if you are doing work with Downtime Trace, then it would go down the pathway towards additional income. And Jason, any other comments you'd want to make on that?
No, I think you hit it right on. But yeah, as it applies to us, any profiles coming from SkillNet just adds a little bit more validity to the customers. Like I said before, we're a tool for service providers to reach out and communicate with customers directly. But this is a part of that communicating that SkillNet record. And yes, so it could increase opportunities to earn extra income through the Downtime Trace.
Any more questions, John?
Good answers. I did have a question. If the healthcare provider has the subscription or buys access or whatever, do they get access to all of my information in the app? So like, for example, if I'm putting in weaknesses and stuff that I want to work on, do they get access to everything I put in or only to certain parts of the information?
They get access to everything you put in, and while we could have some hidden areas, we've not had that request yet. But yeah, so I think transparency is helpful. If you're not good at something, no reason to hide it. And if you put it on the table, maybe you can get some training if it's something you wanted to take action on.
I agree, Mike.
Sounds good. Sounds good. I had a question come in, and this might be one that you'll follow up with an email, but kind of what's the cost if you are a service provider, independent service organization, and you want to join? I don't know if that's, you know, a one price for everyone, but maybe something that we can share that with you, and you can follow up via email with that person and speak directly to their needs.
Yeah, I
Sure,
would
be happy to.
Another question we had is, are there techs today already using this approach to earn side gigs or get fast tracked into higher roles?
Jason, why don't you take that?
Yes, so Downtime Trace is up and running. We are actively seeing new trace tickets being completed every day, and paying qualified technicians to perform work in imaging repairs right now. Again, we're moving quickly towards other specialties and other modalities. In the state of Texas and Florida is where we're at today, but very quickly we're expanding in the coming months to other places as well. We're bringing on early adopters in every specialty. So if you have any interest at all of signing up, it's free to sign up. It's free to have your Downtime Trace member account created. So when we do expand, as we do get more customers and more healthcare institutions coming on board ordering a service, you would be set up and prepared and ready. SkillNet is helping us in the background right now. We're actively looking towards more integration, automation integration, so the SkillNet profile can be even more impactful in each of your bids to the customer, and we can display more of that information. So SkillNet, us and SkillNet's a progression, and we're just partnered to help us manage your qualifications. But as we move forward, we're looking towards more integration and ways to promote that SkillNet profile to customers.
All right, sounds good. The questions we have remaining, we'll share those via email so you can reach out to the people who asked them. We're running out of time here. Great webinar today, lots of information. Thank you so much for sharing this technology and this new approach with our readers. And want to thank you for sharing this with the TechNation community. The winner of today's multi-tool for correctly answering the trivia question is Michael Lewis in Illinois. Illinois is the state that has the most pumpkins, and it's interesting that Michael is in Illinois, so I wonder if he knew that or if he had to use the Google machine to find the answer real quick. Now, a quick reminder that you can obtain your CE certificate by completing the post-webinar survey. The survey will be emailed in 1 hour. You must complete the survey to receive your 1 CE credit from the ACI. You will be able to download the certificate directly from your computer once the survey is submitted. If you have any questions, you can reach us through email at webinar@mdpublishing.com. Also want to mention that there is a handout with today's webinar on the taskbar. If you want to download that, the upcoming MD Expo in Dallas is coming up in just a couple of weeks. And registration is now open for the imaging conference. You can go to attendice.com to find the dates and all the information about that, including some great education. That's going to be in San Antonio in February, so attendice.com. Also, voting for the 2026 Tech Choice Awards is underway. Please visit onetechnation.com/Tech Choice Awards to vote for your favorite nominee. Voting ends on January 9th. This is the TechNation awards that are voted on completely by the industry, and the biomeds, the people who vote, select the winners. So again, that's the number onetechnation.com/Tech Choice Awards. All right, thank you everybody. Thank you for your attention. Thank you, Dave, Jason, and Mike, for all your insightful information. And everyone have a great day.
Thanks, everybody.
Thanks, everybody.